Martina Reddick. She's a registered nurse for over 40 years. She spent her time practicing in St. John's, Newfoundland. In 2003, she completed the Norton School of Lymphatics Complete Decongestive Therapy course. Following completion of the course, she went on to develop the first lymphedema program in Cancer Care Newfoundland in 2004, where she continued working as a lymphedema coordinator for 10 years. Martina is one of the founding members of the Lymphedema Association of Newfoundland and Labrador, LANL, a past member of the Advisory Board and Education Committee of the Canadian Lymphedema Framework, the CLF, and currently she provides education as a consultant for chronic edema, lymphedema, using compression bandaging techniques to healthcare professionals nationally. And Martina has presented to audience locally, nationally, and internationally. So it is with great pleasure that I introduce her as our speaker for today.
It's a pleasure to present to you on behalf of the Lymphedema Association of Newfoundland and Labrador. And the topic is management for healthcare providers. So our Lymphedema Association is a volunteer-run registered charity that was formed in 2014. And its mission is to promote health by promoting access to related counseling, information, group support, or programs to individuals who are affected with lymphedema. Also to advance education, and we provide support to individuals, so your patients, referring them to the Lymphedema Association of Newfoundland and Labrador's website will connect them with others suffering from lymphedema. Other work hosting a support group called Lymphy Connections. There's a website and Facebook page with information. And now we are in the process of reviving a provincial working group with the Department of Health and Community Services and with regional healthcare authorities. We started a pre-COVID, then COVID happened, then we ended up with some changes within the Department of Health, so we are hoping to revive that going forward. There's public forums held every year, and this year, unfortunately, had to be canceled due to COVID. And we're raising awareness, such as providing information to healthcare providers. So what is lymphedema? Lymphedema is a chronic debilitating disease in which excess fluid called lymph collects in the tissue and causes swelling. Any edema that's present greater than 3 months is considered chronic. So we also get swelling of the subacute tissue. It could be the result of trauma, it could be the result of damage, or it could be a problem with the normal anatomy from birth. It usually occurs in the arm or leg, but it can also occur in the chest, trunk, head, neck, and genitals. And I brought information to a family doctor, and when I went back, she said, I thought lymphedema only developed in the arm. So the education is not out there. So there's 2 types. There's a primary. It can be genetic. They can be born with it. Usually, most of the primary, we see a change in puberty. And we have 2 types. There's lymphedema tarda and lymphedema. There's 2 types. One begins before the age 35, and the other is after. But the 83% develops before the age of 35. And on examination, they may notice a swelling in their leg. And it's usually not diagnosed early enough. It may take years for that diagnosis to happen with a primary. With a secondary, it occurs due to damage to the lymph system, such as surgery with lymph nodes removed, just radiation alone. It can be a trauma. You can have an infection of the lymph system and present with swelling. It can be the first sign of a tumor compression or obstruction. We see a lot of patients with venous insufficiency develop a chronic edema and lymphadenopathy. So what is the prevalence in Canada? And the Canadian Lymphedema Framework, in conjunction with the International Lymphedema Framework, completed a review of the prevalence in Canada. And there's an estimated 2.8% of the population suffer from lymphedema, chronic edema. So we have up to 1 million for 36 million population here in Canada. But here in Newfoundland, if we extrapolate from that study, there's an estimated 15,000 affected. However, this number I think is lower simply because the comorbidities here in Newfoundland, such as morbid obesity, and our International Lymphedema Framework document states that 85 to 95% of morbidly obese patients will develop a degree of lymphedema. Also, our cancer rates are higher, so we probably have more than the 15,000 that we extrapolated from that number. So what is the impact of lymphedema on our healthcare system? And Dr. Christine Moffat, back in, I think it was 2004, had completed a study in the UK that 27% of the study population were admitted to healthcare facilities for a cellulitis. And that cost in pounds was 2,300, which is about 4,000 Canadian. So the potential cost, if we extrapolate from that study, the potential cost to Newfoundland healthcare for lymphedema-related cellulitis could exceed $16 million annually. And we do not have a disease code for lymphedema in Newfoundland, so patients present to the emergency is considered a cellulitis, and we don't have a specific code to capture that. So the study showed that prevention of infection with timely and consistent treatment would benefit patients, but also it would decrease the burden on our healthcare system. So what are some of the barriers of care? Number one is a global lack of awareness of lymphedema as a chronic medical condition. And that's why we're working with the Department of Health to have lymphedema recognized as such. There's minimal physician education on the lymphatic system in med school. It's estimated to be 30 to 60 minutes. However, I had an oncologist tell me he remembers about 15 minutes on lymphedema in his 12 years of med school. There's no defined domain responsible for diagnosis and treatment, and those patients show up everywhere, in clinics, in dermatology, in plastics, in surgical, because we don't have a defined domain for diagnosing. There's limited access to hospital-based services. We do have in cancer care a lymphedema therapist. We also have in the community in Gander, but there's also lack of funding sources. Much inequalities exist within the regional health policies, and insufficient access to trained therapists, particularly in rural areas. And as well, we do have private clinics throughout our province, but mainly in the Eastern Health region. So how do we diagnose lymphedema? Early intervention and identification is critical to sustain outcomes. It's most often diagnosed through just a thorough medical history and physical. So when we go through their medical, we do our routine medical exam. We ask the questions, when did this start? Is it worse in the morning, worse in the evening? Does it start distally and progress proximally? Because that's the true lymphedema. If something starts proximally and progresses distally, if that patient did not have radiation to a proximal area, that could be an indication of some tumor compression or obstruction. So we need to take a thorough history from our patients. Physical exam includes inspection. Where is the swelling? What are the skin changes we're seeing? Is there a wound? Is there drainage? Is there leakage of fluid through the skin called lymphedema? We need to inspect if there's large lobular areas. We need to lift those up and see if there's any maceration underneath. Palpation is very important as well. And I've had patients that told me that they had been to 6 or 8 different specialists and no one touched their legs. How are we going to diagnose something if we are not touching and inspecting? So for palpation, the temperature. Is it normal on both sides? Is the tissue pitting? Is there fibrosis, hardened areas? The skin test, and there's a skin test that is called a stemmer sign. And what it is you pinch the skin at the base of the toes or fingers, and if it pinches, it's negative. However, if your fingers slide across and you can't pinch the skin, that stemmer sign is positive. And a person by the name of Robin Bajork, she added on that stemmer sign test, and it's called the bow tie test. So you can expand that to any area of the body. If you can pinch it and lift the skin, it's negative. If you can't, it's positive. So physical exam, integrity, note the wounds, the color, the temperature, the texture. We get a lot of hyperkeratosis, dryness, lymph cysts, lymph blisters on advanced lymphedema. Also note the size and shape of the limb. Not only the limb, but the quadrant. If it's a full leg lymphedema, is there edema in the buttock? Is there edema in the genital area? Those are things we need to know. And lymphorrhea, which would be the leakage of lymph fluid through the body. So once we diagnose, how do we treat it? Lymphedema is treated by complete decongestive therapy, and that consists of 5 components of care. The first component is considered manual lymph drainage. And what manual lymph drainage is it's a type of gentle massage that reroutes lymph fluid away from blocked areas. That is a learned technique. It's not a massage therapist. They need advanced training in complete decongestive therapy or manual lymph drainage. All massage therapists do learn some manual lymph drainage, but they have to be certified in order to do it for lymphedema. And manual lymph drainage alone will not reduce edema without following with compression. So compression, which is the next component, is the mainstay of treatment. Compression is the cornerstone. And it's divided into an intensive treatment and a maintenance phase. So in the intensive phase, we are treating that fluid, that limb, or wherever the fluid is located, with compression until it plateaus. When that edema plateaus, we then move them to the maintenance phase. And in the maintenance phase, it's when they get measured for compression garments. And those garments have to be worn every day for life in order to maintain this reduction. And the first compression garment that they get into probably won't be the one for life. So work with a good fitter to ensure that you're getting the best possible fit for your patient. The next component is skincare, meticulous skincare. Be very mindful of any cuts, nicks, scratches. Encourage your patient to treat those areas immediately to prevent any cellulitis. We don't have good information to support, but anecdotally, we recommend that patients with a lymphedema in the right arm use their left for blood draws and blood pressure, because clinically we have seen changes with using a pinprick or a blood draw from the antecubital. So it's important. We don't have good research right now, but there's much more research being done in that area. So good skincare. If they garden, wear gloves. If you're doing anything, sewing, knitting, be mindful. And next is exercise. Exercise should be a daily component of care. And if someone has advanced lymphedema, they're morbidly obese, they may look at you and say, well, how can I exercise? That's where you need to involve a physiotherapist. Get them set on a routine. Even gentle range of motion exercises help move lymphatic fluid, because it's the muscle pump that stimulates the movement of lymphatic fluid. And last but not least is self-management. And I think self-management has to begin on day one. We really need to be diligent in encouraging our patients with knowledge and empowering them to self-manage their condition. So the treatment of lymphedema, the intensive phase, is daily or bi-weekly treatments. It all depends on the type of compression bandage you use. Always ensure you choose a short stretch compression bandage. A long stretch like an ACE or tensor is not recommended for lymphedema management. The patient would receive manual lymph drainage, information on skin and nail care, and their compression bandage applied by a qualified therapist. Exercise would be part of their routine, and again, we would talk about the importance of self-care. So once the intensive treatment has occurred, the self-management phase is critical. And it's important that we are educating our patients throughout the treatment trajectory. So compression garments during the day, and then if the edema is not controlled, sometimes we can teach self-bandaging, or there's nighttime compression bandages, garments out there that you can purchase for wearing at night. Daily skincare and nail care is important. Daily exercise, manual lymph drainage, nutritional care. And again, it's a multidisciplinary approach. If your patient has weight management issues, it's important to involve nutrition as well. And most of those patients are lost in follow-up. And that's what happens to them. Then they stop wearing their garments and the edema is all back. So it's very important to follow those patients and make a habit of every 4 to 6 months, when their garments are due to be renewed, then it's best to follow up and see where they're to with management. So some of the impacts of treatment: we reduce the volume, restore mobility, control pain, and reduce less edema in the tissue means less infection, because we know that cellulitis, when there's fluid in the tissue, it is a high medium for bacteria. Reduce wounds. Any wound, major wound that you're caring for, will have a component of edema. It has been studied, and compression applied while managing the wound closes the wound more efficiently, and also improves quality of life. So this is just some before and after treatments with 1 week of compression bandaging. So the top is before, the bottom is after. This again is before and after treatment, and the skin changes here to here. This amounted to about 4 to 6 months of compression, and now the skin, which I didn't insert the picture prior to sending off, but his skin condition now in this area is perfect. So if being consistent with application of your compression is important. So recently, and this is most recent study that was published in the New England Journal of Medicine, and what it was a study that was undertaken to determine if we can prevent recurrent cellulitis. So compression therapy reduced the risk by 77% in patients with 2 or more episodes of cellulitis who had a chronic edema. And this study was stopped halfway through because the results were so compelling, and they felt it would be unethical to continue. So every patient was provided with compression therapy. So some of the barriers here in Newfoundland to treatment is the distance patients have to travel, inconsistency in standards of practice among healthcare professionals. And, you know, I know when I did work at the Cancer Center, I was part of the guideline group, and you will find on their website under cancer care, there's guidelines for lymphedema. However, looking for guidelines throughout the country, there can be many inconsistencies. Also is insurance companies' lack of understanding of lymphedema management. In one case that I remember so vividly, we treated a patient who reduced readily. And when I asked her to check with her insurance company to see if they'll cover her compression stockings, the response was, we don't cover stockings, but we do cover sleeves. So that is really a lack of understanding there. And also, I dealt quite often with the special assistive device program, which I was told on one occasion, well, we can get them a compression pump under equipment, but we cannot get them a sleeve. But a compression pump is of no value without a compression sleeve. So again, that was a major lack of understanding. Lack of knowledge by physicians and healthcare professionals. Patients not aware of available resources, such as the Lymphedema Association, the support groups, the International Canadian Framework. Non-compliance for various reasons, and every time I have a patient who doesn't comply, I have to wonder, did I do a good job to educate this patient and empower them in self-care? Also, the availability of therapists and garment fitters. If you're treating a patient with lymphedema, reach out to a garment fitter, someone who can fit custom and someone who can fit prepackaged. It's very important that they form a bond with a good fitter so they can continue to work with them for life. And also financial strain. Some of those garments can be $600 and $800, and they need those replaced every 4 to 6 months. So if there's no insurance and they're not covered under the special assistive device program, where do they go? And it's, like I said, pulling rabbits out of hats. I would go to some community groups. Our cancer care program has a patient and family fund, which is very generous with the cancer patients. So you have to look to all types of resources to manage. So why does it matter? Well, we have Karen, who's from Corner Brook, Newfoundland. She's now living in Nova Scotia. And she was diagnosed in 1979 and given diuretics. Now, diuretics are not recommended for a true lymphedema. If there's another underlying condition and they're ordered diuretics, that's fine. But it's of no value, because what happens, it may remove some fluid, but the protein remains, and the protein is what is the medium for bacteria. She was told to lose weight and given diuretics. So her father and most of her siblings have lymphedema. And she was barely able to walk due to pain, discomfort. She gained a significant amount of weight, and her quality of life was deteriorating. So in 2016, which was 37 years later, she found someone who could treat her lymphedema. She then re-entered the workforce. She joined a gym. She took up kickboxing, lost significant weight, and then she established the Lymphedema Association of Nova Scotia. She has been a driving force in that area to educate patients with and healthcare professionals with lymphedema. So those, and this is just one case. I heard this on a regular basis, and a lot of my patients cried in the office because they couldn't get the help they needed. So current best practice is offered on a limited basis. Like I said, the Bliss Murphy Cancer Center, the Central Health Region, some private therapists. If you don't have insurance, it's not covered. So how can we, and I need you to think about this, expand lymphedema diagnosis, upgrade treatment to best practices, and implement it in all regions of the province. And one other thing I didn't touch on, and it's not within the slides, but I really need to bring this out, is the psychological aspect of lymphedema on our patients. You know, we don't realize, I didn't realize until I talked to young patients who presented with lymphedema. They told me they wear a size 12, but they had to get a size 20 pants. Or we had someone who was wearing a black glove because of the edema in the hand, went to a church service and was refused communion by the priest there. Also, I've heard stories of patients going through customs at the airport and being asked to remove their stocking or their sleeves. So the psychological aspect of this is huge. And I think emotional support is important, and we need to involve a therapist if we feel that patient, and the majority of patients do become very depressed. So I think that's a really important piece that's missing in our presentation, but I wanted to share it with you today. Also, if you're looking for more information and you send an email to the Lymphedema Association, we do have Pathways Magazine, and the Pathways Magazine is the only kind in Canada. It has the latest in research, it has case studies, it has patient testimonials, it has garment types, all kinds of information that you can share with your patients. But also, the membership, Pathways Magazine, is included in a $45 membership per year. And the magazine is published quarterly, 4 times a year. So there are some on the website that are greater than 2 years old that you can view. Also, the Lymphedema Association of Newfoundland and Labrador website is here. And the Canadian Lymphedema Framework website and the international website have many publications that are available for download, and they are very informative. They have documents on setting up your own clinic, documents on compression bandaging, and in that document is everything you need to know, like skincare. We have a document for using compression in the palliative setting. We have a document for pediatrics and lymphedema, and we have a document on compression garments alone. There's a whole compendium of documents that I encourage you to review and refer your patients to those as well.